Hi, everyone. Thank you for joining us this beautiful afternoon on our next installment of Healthier You event here at Oswego Health. We're so glad you joined us. This month in June, we get to talk about men's health. So if you're a man or you have a man in your life, I hope you'll join us to learn about some common topics about men. I'm joined today by Dr. Andrew Rogall, who's one of our primary care doctors at Prime Care Fulton, and Dr. Jeffrey Strain, who's one of our general surgeons at General Surgery Associates. Thank you so much for joining me. We appreciate taking your time out to talk to our community about how to live a healthier life. I'm going to ask you both a couple questions. Dr. Rogall, I'm going to start with you. And just remember, if you want to ask us a question while we're talking, you can put it in the chat and we'll do our best to answer your question. Dr. Rogall, we often hear that men sometimes avoid seeking out preventative care. And so when they finally do, there could be something more wrong than they would if they had been at seeking care sooner. Why is it important for us to get primary care?
Well, I mean, all too often I'll have new patients come in and they haven't seen a doctor since decades ago. They're a pediatrician, and I often hear, well, I've been healthy, so I haven't had to come and see a doctor. And then they're here ultimately because there's some sort of new symptom that's become uncomfortable enough to the point where now they want to come and see us. And it happens more often than I would like, but it really shows the importance of coming in at least yearly to see us so that we can catch some of the things that kind of go unnoticed and are asymptomatic before they become too much of an issue. Like high blood pressure, high cholesterol, type 2 diabetes are often going to be asymptomatic until they cause a bigger issue, where if we catch them earlier and we start to treat them earlier and we work on prevention, then we don't get to the point where it ever really becomes that much of a problem.
Great, thank you. Good point. So if you don't have a primary care provider, call us today. Make sure you get in for those annual visits. Dr. Strain, to you, we are going to talk about hernias this afternoon. So why is it important if you have a lump or something that you're unsure of what it is, such as a hernia? We've been hearing more about that. Hiatal hernias, what is it? How can it be treated? Why should we come and see you?
Well, a hernia is a weakness in the abdominal wall in a specific place. And most commonly, this happens in the groin. Most commonly, this happens in males. And it occurs in two periods of the life, one in the newborns, essentially newborn babies below the age of 3, and then typically men over the age of 50. And someone who has developed a new painful lump, typically in their groin or typically in their belly button, should have this looked at. One of the concerns that we have is when these weaknesses develop, we sometimes get an outpouching of intestine, either in the groin or in the belly button. One of the dangers we have is if the intestine goes through one of these defects and twists, loses its blood supply, it's a surgical emergency. So when there is a change either in the groin or in the belly button, it should be evaluated to see if this is a hernia. And if it is a hernia, it should be treated.
Great, thank you. Those are important tips. So be on the lookout. Dr. Rogall, to you again, we're going to see if there's any questions from the community, but what are some tips and tricks that we could use for men to be able to keep themselves healthy? What preventative screening should they get? Any advice that you have for us?
Yeah, as far as what to do to stay healthy, there's nothing really glamorous. It's really the basics. So making sure that we're really monitoring our salt intake so our blood pressure's not getting too high. Exercise is a big one. And I know everybody's living busy lives these days, but we're really looking for 30 minutes of exercise a day, at least 5 days a week. Even those that are working hard physical jobs, exercise outside of the workplace is really important. Moderating alcohol intake, making sure that we're increasing fruit and vegetables into our diet, not just eating red meats, potatoes, carbohydrates, and things like that. Those are really the basics that keep us healthy from day to day. As far as screening goes, and I mean, Dr. Strain can probably weigh in on this one too, but starting at age 50 for everybody, not just men, but I know men seem to be the one that tend to be more resistant, but for colon cancer screening, we've got guidelines out there now that show that low-risk patients could potentially do a Cologuard, which is a stool test that's sent to them in the mail yearly looking for blood. If there's ever blood in it, then they'll need a colonoscopy. Or we can go by the old standard of starting at 50, if you're low risk, getting a colonoscopy between every 5 and 10 years, depending on what they find. And again, those preventative screenings really do go a long way in keeping you healthy. Prostate cancer screening is a bit of a different story these days. We're not doing it as frequently for asymptomatic patients as we were previously, but certainly monitoring for symptoms and coming to see us so that we can make sure that patients are staying low risk would certainly be key to your health as well.
Great.
Just to kind of dovetail on that comment as well too, with screening, especially for colon screening, family history really is important. So age 50 is the bottom line, but if there is a family history in first degree relatives, mom, dad, brother, sister, it's a discussion you really should have with your doctor in your 40s to see about optimal surveillance.
Yeah, and I think there's a change in recommendations in draft right now, where in the next year or so that might actually decrease to potentially 45. So yeah, so it's just been shown that screening earlier and more often, just it really does save lives. So
That's great. And right along that line, we do have a question from our audience. And Dr. Shane, I think it speaks to what you were talking about. Maybe we can just be a bit more specific. So if my dad had a heart attack, how likely is it that I may have a heart attack? And is there anything that I could do to help prevent that? It's a question from our audience.
I think I'll pass it over to Dr. Rogall, because that's more of a primary care issue than it is a general surgical issue.
Great.
yeah, so when it comes to heart disease, whether we're talking about heart attack, stroke, congestive heart failure, high blood pressure, there certainly is an increased family risk when you have family members who are diagnosed with those diseases. Really, the increase in risk is going to come from any first degree family member. So sibling or parent that has heart disease or stroke before the age of 50 in males, 60 in females, or if it's something that's very pervasive throughout the family. If it's known that people in the family are having heart attacks, strokes, having stents placed under the age of 50, or if everybody's being diagnosed with high cholesterol earlier in their 20s, 30s, then that's certainly going to increase your risk. There are other things that might not necessarily increase your risk, depending on what your family member's smoking history is, alcohol history, what their diet's like, what their exercise levels like. So there are certain things that will certainly predispose you to having earlier risk, and some of it is more of a lifestyle in those family members, which may not impose much of a risk to you. It really depends on the patient.
Great, thank you. So some things that you can do, again, if you have questions, make sure you have a primary care provider that you can go and talk with as well. That's going to conclude our series today for Healthier You. Thanks for joining us to talk more about men's health and ways that we can stay healthier in our community. I hope you join us next month as we talk about another topic. And as always, thanks for getting your care here right at home.